Hello, I'm Nathan Anderson, Vice President of Product for Sterling Healthcare. At this stage in the pandemic, states are starting to reopen, but what does that mean for healthcare providers like you and your background screening programs? Today, 31 states have begun relaxing their requirements in various ways, mostly allowing small businesses to reopen under strict guidelines about what they can and can't provide. But this is far from a return to normal. In fact, government agencies have started to partially reopen, but many employees are still working from home. A lot of county courthouses, for example, are operating under much reduced hours, and they also have restrictions in place, such as allowing only a certain number of people in the court at one time, or even for certain individuals, the number of requests that they're allowed to make per visit. Today, 988 county courts are still closed or have reduced access. That accounts for about 30% of all county courts. So what should you expect in the current situation? First of all, understandably expect longer turnaround times. So due to the restricted access and the limited availability, it's hard to predict how long a given search is going to take. Another thing to consider is potentially running statewide searches as an alternative to county courts where they're closed. Keep in mind that many states have additional consent and potentially higher fees as well. And some states, such as California, don't offer a statewide altogether. But it is something to consider as a potential alternative in the meantime in those states where it is available. Next, it's very important to stay up to date on the changing regulations. Many states that have started to relax certain emergency orders, this doesn't apply necessarily to healthcare agencies and healthcare providers. A good example of this is the changing regulations in Florida by the Agency for Healthcare Administration. In late March, they relaxed the requirement for fingerprinting to no longer require an FDLE Level 2 fingerprint check due to the number of live scan locations that have been closed. In its place, healthcare providers were allowed to run searches for FDLE Level 1 name-based criminal checks, in addition to national sex offender and Florida career offender searches. This order expired, though, at the end of April, and it was unclear whether or not the fingerprinting requirement was back in effect or not. After a few days, AHCA came out and they provided an alert to indicate that, in fact, fingerprinting was required if the candidate can access live scan sites. Otherwise, the alternative search could be used in the meantime. Other states have extended their emergency orders, such as in Illinois, Oregon, Minnesota, and Georgia, where there are still fingerprinting exceptions in place. The best way to stay abreast of these changes is to subscribe directly through the agency to receive alerts and notifications when they announce additional changes. You can also work with your vendors, such as Sterling, to stay up to date. For example, we maintain a list of all the county criminal closures on our website through an easy-to-use interactive map. And we also send out frequent updates via email to our clients to notify you of any changes that can impact your screening program. Now let's look into the future, to a time when we return to the pre-pandemic operations. What do you need to do to address all the impacted searches that were run during the pandemic? First off, you need to understand what your obligations are at a state level, a CMS level, and with your accrediting bodies, so you know which searches you do need to rerun or don't. For example, going back to fingerprinting, most of the exceptions require that fingerprinting be rerun on those individuals that had a waiver during the period within 30 or 60 days. The best way to identify searches that were impacted is to leverage reporting with your vendor to see which searches can be fulfilled at the time. So for example, you can run a report to find all county criminal searches that couldn't be run due to court closures, or you could identify any drug or clinical services that couldn't be completed because of lab unavailability, or even verifications for employment or education that couldn't be fulfilled. Once you've identified these, then you can selectively go back and run those searches on individuals that are still employed with you, potentially expanding some of the searches you did for contractors or temp workers that you want to convert to full-time, and also taking any sort of adverse action that is required should you find anything that occurs after the fact, since all the same compliance requirements apply to employees as they do pre-hire to candidates. Regardless of what comes next, Sterling will continue to work with our clients to help adapt to the changing environment. Thank you for watching, and please keep an eye out for more videos from Sterling Healthcare.